Hello everyone, I'm Shafiya Shaikh and I'm a medical student at Kyrgyz National University and I'm currently studying in my second semester. I'm submitting this video to Dr. Kuldeep sir, and the topic I'm going to explain to you today is the rectus sheath. Now, as we all know, the rectus sheath is a strong fibrous sheath present on the anterior abdominal wall and encloses the rectus abdominis muscle. You can see the muscle here in this image. The origin of the rectus abdominis muscle is the pubic crest and the pubic symphysis, and the insertion is the xiphoid process and the 5th, 6th and 7th costal cartilage. Let's look at the formation. It is formed by the aponeurosis of 3 flat abdominal muscles, that is the external oblique muscle, the internal oblique muscle and the transversus muscle. These provide stability to the muscles and the structures present in it. The contents: the rectus sheath contains the rectus abdominis muscle as seen in the prior slides. It also contains the pyramidalis muscle when present. Now we say when present because it is almost absent in 20% of the people, but its absence doesn't really make any difference. As you can see, it is a small triangular muscles present on the lower abdomen. It also contains the superior and the inferior epigastric vessels and the terminal branches of the lower thoracic nerves. The functions of the rectus sheath: it encloses and supports the rectus abdominis muscle, that is, it assists with the functioning of the muscle. It helps the muscle function efficiently. It protects the blood vessels and the nerves. As we have seen in the contents earlier, the rectus sheath contains superior and inferior epigastric vessels and also the terminal branches of the lower thoracic nerves. It makes a protective layer and reduces the chance of injury. It strengthens the anterior abdominal wall. It also helps the abdominal content to not protrude. It helps transmit the force of abdominal muscle contraction, that is, it assists in movement like cuffing, bending and also maintaining posture. Last but not the least, we have the clinical importance. Now, rectus sheath is clinically important in abdominal surgeries as it serves as a landmark during the surgeries. It is also a site for rectus sheath hematoma. Now, rectus sheath hematoma is the accumulation of blood in the rectus sheath itself, which is usually due to the injury of the superior epigastric vessel or the inferior epigastric vessel. Next, we have hernia formation. The weakness of the abdominal wall, including the rectus sheath, may result in the abdominal content to protrude, which may result in hernia. So this was all about the rectus sheath. Thank you so much.